Okay, so now that you've kind of been caught up with what we can learn about the brain, what we have learned about the brain, let's look at maturation of the brain in children and see what affects experience and how those effects on experience affect the maturation of the brain. I'm going to start with research on poverty because this is relatively new research for all of us. Kimberly Noble has been looking at the effects of poverty on cognition for over 10 years. But in March 2015, she published a study in the journal Nature Neuroscience looking at the effects of poverty on the surface area of the brain. She now is looking at what we were talking about, the brain in terms of how many dendrites you have. And remember, dendrites are going to be experience dependent. When you're measuring surface brain area, you're looking at which parts of the brain are thicker, which parts of the cortex are thinner. And what she found is that if she had a wide distribution of income, children from wealthy homes, children from middle income homes, children from homes of poverty, that small differences in income among children in homes of poverty made large differences, or had large differences, showed large differences in surface brain area. On the other hand, children who came from high income families, similar increments in income really weren't associated with much difference in surface area of the brain at all. In other words, the surface area of the brain and the thickness of it and the sophistication of it, if you will, or the maturation of it, is affected by poverty. Now, these were the scans that she had. They're in the article. And again, among the low-income families, small differences in income were associated with relatively large differences in surface area. The relationships were most prominent in regions supporting language, reading, executive function, and spatial skills. So what we see is that socioeconomic conditions do affect areas that are very important for learning and school. So this is important for us as speech language pathologists because what this means is that children learn to perceive speech sounds, that temporal lobe becomes mapped for the phonemes of our native language, and then we learn to read and it becomes more fine-tuned. So once you can read, you can actually listen better. And what that means for us, for our students who have auditory processing issues and speech sound perception issues, speech sound discrimination issues, is that they're going to have trouble learning in a classroom when you compare them to children who are good readers. So not only do they have problems learning to read, they also are probably going to have a lot of problems learning in general in a classroom situation. Now, what do we have in terms of neuroscience evidence for reading? Okay, because many of us are involved now in literacy intervention. Well, we have some good research that was published by Youngchiva, Wise, and McCandless in 2015 and published in the journal Brain and Language, showing that phonics-based approaches are more effective at getting the desirable brain changes that we want for reading, and alphabetic language especially, than whole language approaches. The research came out of Stanford University, and as I said, it was published in the journal Brain and Language in 2015. And what they found is when you teach young children phonics, then that primes the areas of the brain of the left hemisphere that are going to be needed for reading an alphabetic language. So you're priming the visual word form area, you're priming the angular gyrus, you're priming the left hemisphere superior temporal lobe. On the other hand, if you teach children to memorize whole words, sometimes that's called the whole language approach, sometimes it's called sight reading, that activates more right hemisphere structures. And when you activate more right hemisphere structures, you're activating parts of the brain that we don't use as actively when we're reading, that you don't see in good adult readers. Not only do phonics-based approaches have better outcomes, the students learn to read faster, they learn to read more effectively, but we can also have this neuroscience-based evidence that in addition to the behavioral changes, you see neurological changes that are more constructive, moving toward what we know to be the parts of the brain that you use if you are a very good reader. So we have it supported both by neuroimaging and by behavioral studies.